Today we are going to be presenting on asthma. Asthma is a chronic condition, but it can be managed. It's when the airways in the lungs become inflamed and narrowed, and can also produce excess mucus, which causes obstruction of the airway. And these obstruction makes it harder for air to flow out of the lungs, and people with asthma describe it as feeling like breathing through a straw. Some signs and symptoms, they vary from person to person, but the main ones include coughing, wheezing, chest tightness, and shortness of breath. Pulmonologists, allergists, and pediatricians can all diagnose asthma, and they'll do it with a lung or pulmonary function test, which includes spirometry and peak flow, and these are done before and after taking a bronchodilator. So if your pulmonary function tests improve after taking the bronchodilator, it's indicative of asthma. And then here are some additional tests that they can help diagnose with asthma, like imaging, allergy testing, nitric oxide test. And then here on the right, we have an asthma severity classification with different characteristics from mild to severe to life-threatening asthma.
And then just to reiterate a little bit what Heather said, repeated cases of pneumonia and bronchitis is one way asthma can present itself, along with constant coughing at rest or during exertion, whistling or wheezing with expiration, chest tightness, shortness of breath, and tachypnea. Kids will often say, "My chest feels funny, I'm always coughing, and my throat feels small." There's no current lifespan limit for those diagnosed with asthma. However, especially if it's controlled. However, a 2016 Danish study found that asthma may shorten your life expectancy by about 3.3 years, but further research is needed to confirm anything like that. Some precautions are to avoid known triggers such as air pollution and secondhand smoke. You should be taking your medications as instructed by your doctor and manage your symptoms carefully. Uncontrolled asthma can lead to damage of airways and missing out on life events due to increased time in acute care settings.
And some meds that the children could take. There's long-term ones and short-term. The long-term are inhaled corticosteroids, or there's also combination inhalers. These can either be taken by themselves or together. They're all just inhalers. And then the short-term is just short-acting bronchodilators. This is kind of common for those just who need it right then and there. And then some DME. I took this image from the American Lung Association because it kind of just described everything perfectly with the images. So some DME are nebulizers, peak flow meters, and valve holding chambers. Not all people with asthma will have these, but it is a possibility for them to have these in their home. And then some specialists that are expected for someone with asthma to see kind of regularly would be their pediatrician, an allergist or immunologist, a pulmonologist, or a respiratory therapist. But the number one is typically the pulmonologist, just to help with any severe or complex asthma.
Some short goals. Our patient is a 6-year-old, and the short-term goal would be for them to be able to independently perform aerobic interventions while being asymptomatic, meaning have any of the chest tightness or wheezing or coughing, from about 5 minutes to 15 minutes of continuous activity in roughly 2 months, while in an outpatient indoor clinic, so they're not exposed to some of those outdoor weather things that can cause their asthma, in order to improve their cardiovascular endurance and duration of aerobic activity, to participate in peer-related activities at home, in the community, and at school. Long-term would just be 15 minutes of asymptomatic to 30 minutes over a 4-month time span.
All right, and there's a lot of outcome measures that we can use to kind of evaluate our patients. So there's a few patient self-reported questionnaires. So the ACT or asthma control test, or the PROMIS, and a parent proxy is required for that one for children ages 5 to 17. There's also the PRAM, or Pediatric Respiratory Assessment Measure. So that just is another subjective test. Developmental Assessment of Young Children, second edition, the DACY-2, we've been over that before, and the BOT-2. And a lot of these focus on their physical abilities. And while you're checking their physical abilities, their like gross motor, you can determine whether or not they are having asthmatic symptoms or if those are causing like a flare up of their asthma. And on the next slide, I've inserted a few pictures just as examples of what you might see on some of these tests. So the self-reported ones, a lot of them have pictures so that the kids can understand and relate to those and report it accurately. But then the other ones like the BOT-2 or the DACY-2, those are more for us as therapists to look at and be able to score appropriately.
And then some interventions that we came up for our 6-year-old and include like skipping with an alternating straight arm and overhead flexion. This is just on their cardiovascular endurance, but also lower extremity strength, the balance, and some thoracic mobility since they already do have that decreased lung capacity. Anything we can do to help get that thoracic mobility up can be for them. Things like cone drills where they're running forward, doing karaoke, running backwards, but making it fun by adding in like a balloon that they have to hit with a baseball. And then also a lot of our research showed that just even dancing is a really good way to increase cardiovascular endurance in these patients and as a way to make it fun.